It's Mira Business FM. It's the morning drive with me, Tim Elliott. We are live on the website, mirabusiness.fm, across your socials. I think that's an okay phrase. info@mira.fm to get in touch. whatsapp.mira.fm so you don't need to remember the phone number. Subscribe, give us a like, let us know what you think. Now, let's talk careers, medical careers, and talk to a consultant in family medicine. Dr. Mufaza Asrar Rashid is joining us over Zoom. Dr. Mufaza, it's a pleasure to have you on the show. Morning. I think you might be muted, Dr. Mufaza. That
There
could
we go.
be. There
Oh,
you
great.
go. Do you know, that's
Right.
it's always the way with Zoom. You're always muted when you never think you are. And with me,
Yeah, absolutely. Although it was right in front of me.
it's
But yeah,
that's,
thank you so much, Tim. It's a pleasure being with you.
well, it's nice to meet you. Let's start with your credentials, I guess, first of all, just to find out a little bit about you. You're close to, 25 years as a qualified doctor, 15 years with the National Health Service in the United Kingdom. There really are a few areas I'd like to cover with you today, starting with what you do, the role of family medicine. I think that's really important to take a little bit of a deep dive on. The research you've taken part in and created, and also your charity work, because there are many strings to your bow, Dr. Mufaza. But first of all, what inspired you to pursue a career in family medicine?
Well, it is quite an interesting question, actually, because when you qualify as a doctor, there's so many fields in front of you, and you just have to kind of choose because it's whatever suits your personality, whatever you're passionate about. So if you're choosing a particular specialty, that means that you're only exposed to patients of a certain type. Whereas in family medicine, you are working across a whole age group range, across a whole condition range, and there's a lot you can do which you would not do if you were in a particular specialty. When I say that, I mean that you're kind of a jack of all trades, but you are kind of making a difference across the patient's uh, whole life rather than just one particular problem in one particular system of the body. So when a patient comes to see you, you are interested in their social aspect. You're interested in their financial background. You're interested in everything that they're about, so that you can make sense of why they're experiencing the problem that they have and what impact the other things in their life can have on it. You know the whole family, because if you are as a family physician looking after their whole family, you know the family dynamics, and those things influence health a lot. There's no condition that you cannot discuss as a family medicine, although obviously you have limitations in terms of how far you can go and how far you can pursue independently, and then you have to refer at a certain point if you not manage cannot manage it on your own. But as a whole, you know the person as a whole, and that makes a huge difference in the health outcomes.
You see, I find this really interesting because family medicine is exactly that. It's that understanding of the whole kind of health dynamic of an individual or, obviously of a family. Consultants in particular areas, I have some experience of this. I've had a few medical issues over the last few years, and I've talked to a number of different experts in different things. And sometimes I kind of think to myself, where's the bedside manner with you? Because it can be a little bit more matter of fact. Whereas a family doctor like yourself, you've really got to be able to drill down and understand people. And I think that's a very particular kind of calling, a particular kind of skill.
Yes, absolutely. And also, it just builds up a patient relationship that is quite unique, and the patients trust you. And so, a lot of the times when they may not disclose certain symptoms or certain things that they've never met the person before. Whereas as a family physician, if they've seen you over and over again, they know exactly, they feel comfortable talking to you. So that discloses a lot of information that can be so much helpful in managing their conditions, and which can range from physical to mental to anything.
One of the things we do here at Mira Business FM, on probably about a weekly, bi-weekly basis, is we talk to people in particular careers just to get an idea of why they decided to follow the path that they've followed. I'm wondering, with you in particular, a career in medicine is a huge number of years studying. It's a huge amount of work. It's really a life commitment, and it's, I guess, a vocation. But what do you think, if you can put this into words, the most important qualities for a really successful family physician are?
Mm. Yeah, you're absolutely right there because it's a long process, and I think the times that we're living in now, it's the children or the up and coming young generation have a lot more options than I did at the time.
Mm.
But at the same time, if you are passionate about it, if you like working with people, if you like making a difference to people's lives, I think that's very important because I still meet certain young people because I have worked with the faculty of Royal College in and the University of Nottingham with the careers advice with students. So you see those students who do stand out in terms of their commitment, and they regardless of anything, the number of years or the hard work involved, they do want to pursue that because they have that in them to make a difference to somebody's lives. Because medicine, although it varies across countries, but it is less money focused, but that can be argued. But it's because there's so many lengthy numbers of years of training involved with probably not as much remuneration as some of the finance or economics sectors, or so it does involve certain amount of commitment which is for less benefit for a certain degree, and then more focused on, particularly in when you're training in the NHS, it's very patient focused, and it's not driven by cost or profits as such. Well, it may differ in other parts of the world, but the ethics of it and everything comes down to the fact that there's ethics of being a doctor is that you are putting a patient first and you're putting everything else secondary. So if you have that in your personality, if you feel that you have got an academic head and you've got a thinking head, and the fact that you're good with people, you can speak to people, then it is a career. But for you, but you have to think it through because it's years and years of a lot of hard work, and the learning never stops.
There's a sacrifice to be made, isn't there? Particularly in terms of, if you do a 7, 8 year, however long your particular medical degree is. So it's kind of a calling. You kind of have to, take a Hippocratic oath. You kind of have to make an oath to yourself, I guess, as well, if this is something that you're going to pursue. Um, could you just talk us through, describe some experiences of working with patients of different age groups, because you're really in that bracket where you can really speak to
Mm.
this, I think, from infants all the way through to seniors.
Yeah, so it's an interesting day you have, particularly if you're a GP in the NHS, that your day can be seeing anywhere up to 40 patients. Plus, if you're on call, then you're taking phone calls and emergencies from patients at home. So you 1 minute you'll have a baby brought in by a mother. The next patient might be a young person, mental health issues. The third person might be an elderly patient. So you have to. That's why the training is very geared around how to do this in a time efficient way and not missing any serious concerns. So this is just what our training is all about. So if it's a child, you approach it differently. You have to consider all aspects. You have to consider the safeguarding aspect, and often you will realize that once you are speaking to the mother or somebody, you pick up signs of where the child may be at risk, or health wise, or the safety. So that all those aspects, and it's playing in the back of your head all the time, what things you need to think about with the elderly. As you know, as the UK and elsewhere in Europe as well, there's a rise in elderly vulnerable population, so a
Mm.
lot of elderly with chronic disease. So you have to allow them time, you have to adapt your consultation skills to their needs. You may need to wait longer, you may need to speak to them in a loud tone. You may Sometimes they're just there to vent, and they want to, somebody to speak to. So you have to have the patience and the skill to actually to have a conversation of that sort with them. You can have a patient come in with who's young but has severe mental health issues and doesn't open up and is sitting there quietly, and you have to make sure that they're not self-harming, or they're not going to, when they walk out, they're not going to harm themselves. So there's a lot of challenges. in addition to all the daily simple stuff, you have to keep your eyes open in terms of not to miss anything significant. Because in the countries where your primary care physician is the first port of call, you will see all sorts. You will see the minor stuff, and hidden amongst that will be quite serious conditions which you have to identify and do something about.
So it's really a profession that needs a real level of emotional intelligence, isn't it? And I guess a sense of, what is it? A sense of community, a sense of kinship as well. So if that's you, it's a great thing. But kind of put the financial element aside in some ways, perhaps. What do you think the biggest challenges are that are faced by family physicians, Dr. Mufaza?
Hmm. It varies from place to place. I can speak from a country to country.
Mm,
If you speak from Dubai perspective, I feel that because it is not a very uniform system across the whole place, and different insurances, different hospitals do it differently. So you may not have a lot of access to your patients' past medical history, or the systems are not integrated, so you don't know where they've been, what's been done for them. And I think the patient expectation sometimes is different. So the type of patient you see here is very different to the one you see in the UK. So I'll tell you the comparison in a minute. But also the fact that they're once you have if you manage to refer them on, often you don't see that patient back, and that gets taken on by another specialist. And so the continuity may break there. It's not a generalization, it may be different as well, but often you see that you might lose the patient if but whereas in the UK, if they're registered with your practice, they will come back to the
mm,
same doctor,
mm.
or more or less at least the same practice, and their notes are there. Even they're often integrated, so you can look at them wherever they've been, what hospitals they've been to. So that helps a lot. So in the UK, the challenge is that the appointment times are short. You're looking at 10 minutes, which is often not enough to help with the problem that is severe. Also, to have enough communication, to show the empathy, to build that communication for the patient to open up to you. However, we do continue to do this, and the appointment times have not changed. Also, there are NHS is under cost constraints, and we are seeing problems with access, patients not getting appointments in time, and the government obviously is always focusing on helping with that. But those are the biggest challenges in terms of the cost saving, plus what's best for the patient, and constantly balancing that out.
Do you think that there is a different expectation of on doctors here in the UAE because it is an insurance-based system rather than a state healthcare system? Because there are fees involved here, whether it's a copay or perhaps somebody doesn't have insurance that covers whatever procedure they may require. Are you treated in a different way by patients, do you think?
Yes, definitely. Over here, we have the luxury of time. So, because you're not seeing as much volume of patients, so even with somebody with a simple cold, you can end up giving them half an hour of your time. Sometimes the expectation is to do that, and then you're actively told by your practice that give them as much time as they need,
Mm.
even no matter how simple the procedure is, because the condition is, because they are often they're either self-paying or insurance covers them. Also, the patient expects that you do there's a prescription, or if there are tests, they do have a low threshold of expecting tests, which if they're not needed, then you really have to explain to the patient why you don't need a blood test or a x-ray or something, which is obviously sometimes can be a challenge with the expectation.
Yeah, I do find here I do get sent for tests a lot, and I do tend to come out with armfuls of medicines. But here in the UAE, let's stick in the UAE for a moment. I know that you're a school physician currently. You also get to engage, I guess, with the community in a slightly different way with that. I know that you're keen on promoting healthy behaviour, for example. You hold educational talks and events. How has that added to your skill set?
Yeah, no, it works perfectly because as a school physician, that's part of the role that you have to engage with the community because it's all a public health sort of role where you're helping prevent disease and help instill healthy behaviors, especially in children here, the healthy eating.
Mm.
We do diabetes day, we talk about that. We've had the breast cancer day. We do mental health. In this week, I'm doing a talk for staff and parents around perimenopause. And so we do a variety of stuff which ties in nicely with the work that I do in general, plus with the school and involving parents. Because if I am present here as a specialist and make the most of it, that we signpost parents, because obviously we're not doing a lot of active management here, but we are spotting things. And if the parent, if say if child has some mental health issue, or if they have some sort of we've picked up a sign of some chronic illness, then we can advise parents exactly the pathway they need to take and guide them and follow through the process. And if there's a diagnosis, then we do put an individual healthcare plan in place so that because the child spends so much time in school, so they're correctly managed if they need in school. So it's a great concept because if you see how much a proportion of their time kids spend in school, this health presence and having not really medicalizing their presence at school, but if you're looking at 1800 to 2000 kids in a place every day, a medical presence and kind of guiding the parents, and it's quite reassuring for them as well that if anything goes wrong, so we're in an emergency, or if the child has a condition that needs to be looked after, they have an active presence. We do have children with type 1 diabetes in school, so it just adds an extra layer of reassurance for the parents. We have severe allergies, kids who need EpiPens.
Mm.
We do run trainings for staff, first aid training for staff. So all that, so just helps.
It's also useful, isn't it, when it comes to attitudes towards healthcare, I suppose, to have that presence, because healthcare is changing. Longevity has become a
Mm.
buzzword, and rather than, treating symptoms, it's now more about, or moving towards, preventive healthcare for patients. I'm wondering how you see this kind of shift, because ultimately, I guess, we're monitoring our health a lot more with wearable devices, and there is a change coming,
Mm.
isn't there?
Yeah, yeah, absolutely. Because even comparing it to what it was like 10 years ago, I think because of social media, social media has given voice to a lot of people who have brought around this awareness, even though not always all correct. But before the medicine was all about, you go to your doctor if you have a symptom, and then you get the medication for it. That's the standard route.
Yeah.
But whereas now, because there's awareness about spotting things earlier, how to be there's a lot more about exercise and muscle mass and awareness around perimenopause for women, mental health and all that, so people are more aware of their health and they are much more in control and they have a lot more information available to not just wait for a 10-minute appointment with a doctor to understand what's going on. So I think it has its pros and cons because you don't know what information around is authentic, which we always advise that you do speak to your doctor before you do anything or take any particular medication or any lifestyle change. But these things have helped change the shape how people feel more in control of their health.
Well, they have. But what do you think, though? I mean, I know that it's really best not to Google symptoms. You do need to go and see a doctor, and that's clearly the best advice. But what do you think when you see, I don't know, influencers on Instagram talking about, medical issues, the medical field in the wrong way? How frustrating for you is that?
Mm. Yeah, it just makes the conversation a little bit longer because if somebody has come in with the preconceived idea, then you have to undo that first without sounding patronizing or without sounding dismissive,
Mm.
and then you have to introduce a new idea. So I feel that geographically as well, the health beliefs vary a lot depending on what cultures they're coming from. So you have to first. I think the patient. What I've learned along the process of this career is that as long as the patient feels listened to and understood and shows and the doctor showing empathy, they will agree to anything that you say and they will take it on board. If a doctor sounds dismissive or condescending or not interested, then they're often less likely to follow your advice.
Yeah, I see. This really interests me because I always feel that I'm very much a vaxxer. rather than anti-vax. So I'm very much a
Mm.
person that follows a doctor's advice because in my head, it's very clear that this is a person who's studied, this is a person who has passed a rigorous test to get to where they are. And I get very frustrated by the anti-vax community. However, I have to understand, and I realize this, that ultimately it is your body, your choice, isn't it? And as long as you're being listened to, I guess it's always going to be that way.
Yeah, absolutely. So there's autonomy, there's health autonomy, but you
Yeah.
have to. Our job is to help people make those informed decisions. So if they know the correct information, often they may have read it somewhere, they may have read the wrong research. So if you explain it the correct way, then it's after that it's their own choice.
Mm.
But the informed decision side of things is important. That they have the correct information so that they can weigh up their own ideas.
Let me ask you a little bit about research. I was reading your bio this morning again, and I know that I really wanted to talk about your career, and I want to talk about your charity in a moment. But I'm interested in research that you're involved with. What are you involved with at the moment?
Yeah, that project have mentioned in my bio is the something I got involved in 2011. I went to this talk by a renal consultant, the kidney specialist,
Yeah.
who worked at the local hospital, and he talked about a new idea of introducing some safety measures in the primary care to prevent people from developing acute renal failure. It used to be called, like, failing of the kidneys.
Hmm.
That a certain awareness and changes could be made early enough for before patients got really worse and ended up in hospital. So that appealed to me, and I got involved with their project. And that was I was the only GP on their on the commissioning group, what they used to call at the time, doing is in the primary care. So what happens is with it can happen to a healthy kidney, but there are certain people more at risk of developing acute kidney injury, which is, it doesn't mean physical injury. Injury means damage or failure.
Right.
So it is abbreviated as AKI. So it can happen if somebody is severely ill, if they're dehydrated, and the blood flow to the kidney drops, and that can cause problems with the kidney in the short term. And often, when they're recovering, a healthy patient may recover, but sometimes it might lead some chronic problems. But there are people at risk who are taking certain medication. If they're elderly, if they're diabetic, if they already have chronic kidney disease, they are much more likely to have that problem earlier than a healthy person. So you have to spot those at-risk people, and then in the community, what we could do was raise that awareness amongst the GPs and the practice nurses to if the patient comes to you with an acute illness where there might be a risk of being dehydrated or severe infection like chest infection, stomach infection, do look at their medication. Do make sure that you look at their blood test previous and arrange a blood test in a 48 hours to make sure they haven't dropped their kidney function. So that was a step to have that decrease the morbidity
Mm.
from this particular, because when they present to the hospital, often it's a bit late, and they end up having a hospital stay too long, end up picking other problems on the way, and then kidney health may not come back to normal. So that was really something that was promoting a very active, healthy prevention, which would have a huge impact on the NHS cost as well as patient outcome and all the morbidity.
I want to talk about your charity work. I know you support a charity that was founded after the earthquake in Muzaffarabad in, what,
Mm.
20 years ago, 2005 that happened.
Yeah, yeah. So that was 2005. I mean, I know there've been way too many natural, unfortunate disasters since then or before that,
Mm.
but that one was particularly bad. I don't know how many people remember that, but it was just the whole region of Kashmir was wiped out. Even Islamabad, the city that I come from, which is a very modern city, an apartment complex collapsed, and they affected people that we knew. So we were in the UK at the time, and my husband, and who's a pediatric intensive care consultant as well. He himself and a few other doctors went out there as a lot of others did, to run a camp in the short term, and they helped a lot of children, and they were on the media, everything. But they spent 2 weeks there, and they performed hundreds of surgeries and all that. But when they were leaving, they thought that there's no infrastructure left in this place. These people have got no aftercare. God knows how long it will take for the government to kind of step in and build the infrastructure again. So
Mm.
maybe this is something we need to think about and have a hospital. So because they all come from high standard NHS mindset, they wanted to have like a very properly made hospital. So it took them about 7 years to fundraise and then open the hospital in 2013, which is completely earthquake proof. It's in the middle of a very beautiful valley, and it caters to the local population, which are very, very impoverished and deprived. So now they're seeing about 30,000 patients a year plus, and the hospital started with 50 beds and now it's 90 beds and doing a lot more specialties as well.
It's a huge thing to do. You run a children's welfare program there as well.
Yes. So since I got involved with the school health, and I thought this is such a great idea, because we are picking up problems in children early, even though we're living in a very affluent society, and the children are not even at risk much of malnutrition or anything like that. But we
Mm.
we still pick up things, and we are guiding parents. So in a place like that, where there are orphanages in the catchment, where although they're government run and the kids are looked after, but not much attention is being paid to how they're eating, how their mental health is, how if they're growing well, or all that. So with the help of one of the pediatric nurses, set up a health visiting service. So the nurse goes in a few times a month, and in between, if needed, to review children, to make sure that they don't have any acute problems. Plus, she's monitoring their heights and weights and growth and nutrition. And we picked up so many children with nutritional issues, and supplemented their diets. We've added a social aspect to it. We fund activities. We are providing them books and sports goods, and they're playing cricket now, they're playing football, and they just feel of think of that nurse as a mother figure. The other day, a few children came up to and said, "Oh, can we go on a school trip? Can you organize a trip for us?" So it's very nice to be able to do that. That they can come and ask us for stuff which they otherwise would not have to, because of being under resourced.
These things are not cheap to run. Hospitals cost a lot of money to run. Programs like this need funding.
Mm.
How do you fund this on an ongoing basis?
Yeah, it's completely charity based. It
Yeah.
is the funds, but we've been very lucky that since the outset, the local, because in the UK, a very large proportion of the population comes from Kashmir. So
Yeah.
they felt that this was close to their hearts, and any charity that they were going to do anyway, they then gave it to the hospital. Plus, there are no admin costs in the UK for the charity, so that appealed to people as well. And these were the people, members of community that we knew personally. So they were also in Islam, religiously, you're meant to give 2.5% of your surplus wealth to charity every year anyway.
Hmm.
So that stream of income then becomes, if somebody dedicates that yearly amount to us, then that becomes a steady income source. With regards to my orphanage outreach program, it is actually a very small amount goes a very long way. Just for an idea, like during the month of Ramadan, we provided them meals. The whole month for 60 children, it cost 4,000 dirhams. So that was maybe one person's zakat money. So it's because they're well children. There very few will have health conditions where they need to go into hospital and have active treatment. A lot of them will need a little bit, or out in the community, or they just need extra nutrition. So that just gets taken care of by, so that a little bit of amount of money actually goes a very long way.
Every little helps, doesn't it? It really does. Look,
Mm.
we're talking to today as part of a kind of a career focus segment here on Mira Business FM, but it's also just really interesting, kind of heartwarming as well to be able to talk to you. You've kind of already said this, but I wanted to finish by saying, look, the thing about becoming a doctor is that it's not really a business. For most doctors, I think at heart, it's a vocation. It's not really a money-making thing. It's kind of a life thing, isn't it?
Yeah, absolutely. So it's one of those professions that it's your patient comes first, and as a doctor, that instinct is instilled in you, and also you have that instinct that you're very very mindful of your outcomes, and you what your how well you've communicated with your patient, how well you've understood their problem, and what you've done. So it gives you that feeling of fulfillment, if you have done well, and I think you're driven by that. So absolutely, obviously, you have to pay the bills, and it does it does pay, but it's very very focused on the humanity side of things, and which is kind of, sometimes some people are built that way, and that's why those people choose to then go on and choose this as a career.
It's good that you're built that way, I think. Dr. Mufaza Rashid works as a consultant in family medicine, joining us here on Mira Business FM this morning. Great to talk to you. Thank you for joining us.
Thank you, Tim. It was a pleasure. Thank you very much.
Good
Have
to
a
have
good
you on.
day.
Thank you very much. This is Mira Business FM. It's the morning drive.